Welcome to today's Explainer. Have you ever wondered if those incredibly frustrating, seemingly random health issues you're dealing with, or maybe someone you deeply care about is dealing with, might actually all be connected? What if an irregular period, that stubborn acne that literally won't budge, sudden weight gain, or even hair loss aren't just isolated annoyances, but your body actively trying to warn you about something bigger? Today, we're going to decode those signals.
Okay, let's dive right in. We usually treat our symptoms in total isolation, right? We head to a dermatologist for the skin stuff, we try some trending new diet for the weight, and maybe we just kind of quietly accept feeling totally exhausted all the time. But honestly, when digging into the research for this, I realized we really need to treat this like a biological mystery. What if all these things are actually interconnected clues pointing toward a singular culprit? Well, let's look at exactly what your body might be trying to tell you.
Which brings us to part one of our investigation. The hidden warning signs, and exactly what to look for. The condition we're actually looking at here is Polycystic Ovary Syndrome, or PCOS. Basically, it's a hormonal disorder affecting the ovaries, and it's characterized by irregular ovulation, higher than normal levels of androgens, which are a type of hormone, and multiple small follicles. But hey, here is a massive misconception that completely blew my mind when looking into this. Despite the name literally being polycystic, not every woman with PCOS actually has ovarian cysts. No way, right? It's a condition that affects millions of women worldwide, and incredibly, millions have it without even realizing it. Because the symptoms vary so wildly from person to person, it just sort of hides in plain sight. And ignoring it, well, it's not just about day-to-day frustration. It can deeply affect fertility, hormone balance, and your overall long-term health.
Moving right along to part two, the 10 early signs. These are our biological clues.
Let's start putting the pieces of this puzzle together with clue number 1, irregular or missed periods. Honestly, this is often the loudest alarm bell. For someone with PCOS, the menstrual cycle might stretch out and become longer than 35 days, become super infrequent, or actually just stop altogether. It essentially means the body is really struggling to release an egg on a predictable schedule, throwing that standard hormonal rhythm completely out of whack.
Now, signs 2 and 3 often go hand in hand: unexplained weight gain and acne. A lot of women find it unbelievably difficult to lose weight, particularly holding on to it around the midsection. This specific type of stubborn belly weight is actually deeply tied to how your body processes insulin. And right alongside that, those higher androgen levels we just talked about can trigger persistent stubborn acne. We're talking breakouts not just on the face, but frequently flaring up on the chest or the back too.
Okay, this next part highlights one of the most frustrating, almost cruel paradoxes of PCOS. On one hand, sign 4 is excess hair growth. You might notice dark, coarse hair popping up on the face, the chin, the chest, or the stomach. It's a direct symptom of that hormonal imbalance. But then, right alongside that is sign 5, hair thinning. So while body hair might increase in places you definitely don't want it, the hair right on top of your scalp can actually become thinner and start shedding. It's a completely contradictory set of symptoms, all caused by the exact same hormonal disruption. Just wild.
Clue number 6 is difficulty getting pregnant. Remember earlier when we talked about how the body struggles to release an egg predictably? Well, if ovulation is irregular, the window for conception becomes highly unpredictable or sometimes non-existent in a given month. Navigating infertility is just an incredibly heavy emotional burden. And for so many women, it's often the very first time they actively seek out a doctor to figure out what's happening beneath the surface.
Moving on, signs 7 and 9 are very specific physical clues that show up right on your skin. Sign 7 refers to velvety, dark skin patches developing around the neck, underarms, or groin. Medically, this is called acanthosis nigricans. And listen, this is not a hygiene issue at all. It's actually a physical red flag for insulin resistance happening inside the body. Pairing with that is sign 9, skin tags. These are those small, fleshy skin growths that are notably more common in women with PCOS. Think of them as tiny physical markers warning you that something metabolic is shifting. But we absolutely cannot overlook the invisible symptoms here. Signs 8 and 10 represent the heavy internal toll of this condition. Mood changes like severe anxiety, depression, or really intense mood swings are incredibly common, as those hormones fluctuate so unpredictably. And then there is the crushing fatigue. Because of the insulin resistance and the utter hormonal chaos happening internally, you might find yourself feeling completely exhausted, drained, and just tired, even after you've had a full night's rest. Your body is basically working in overdrive.
All right, let's do a rapid-fire recap.
We're looking for irregular periods, weight gain, acne, and excess body hair while simultaneously dealing with hair thinning on the scalp. Add to that conception issues, dark skin patches, skin tags, mood changes, and crushing fatigue. Seeing these 10 signs all grouped together like a checklist, it suddenly makes so much sense how these supposedly random issues are actually deeply connected.
Which brings us to Part 3, Causes and Diagnosis, how doctors are actually cracking the case.
So we've seen the clues, but what's the actual culprit? Well, science hasn't found one single cause just yet, but there are 4 major suspects that tend to layer on top of each other. First, genetics definitely play a strong role. Then there's insulin resistance, which we know drives so many of those metabolic symptoms. Third are higher androgen levels, and finally, systemic inflammation. In most cases, these factors all combine, basically creating the perfect storm for the syndrome to take hold.
Now, getting an official diagnosis is a comprehensive 4-step process. Step 1 is a deep dive into your medical history, really talking through all those clues we just outlined. Step 2 is a physical exam. Step 3 involves blood tests to check those crucial hormone and insulin levels. And Step 4 is a pelvic ultrasound. But here is the most empowering thing to know before you ever walk into a doctor's office. A true diagnosis uses a combination of your reported symptoms and these tests. It should absolutely never be based on an ultrasound alone, especially since, like we said earlier, not everyone with PCOS even develops cysts.
Let's head into Part 4, Taking Back Your Health with Management Strategies.
While there isn't a definitive cure for PCOS just yet, I really want to shift our focus away from the anxiety of the symptoms and move toward empowerment. Because millions of women successfully manage this condition every single day. You can really tackle this from 2 sides. First, through everyday lifestyle habits that are entirely in your control. Things like eating a balanced diet rich in veggies and lean protein, prioritizing regular exercise, getting a solid 7 to 9 hours of sleep, and actively managing stress. The second side is through targeted medical treatments. Depending on your personal health goals, a doctor might recommend hormonal contraceptives to regulate your cycle, medications specifically designed to improve insulin sensitivity, or even targeted fertility treatments if you're looking to grow your family.
We've covered a whole lot of ground in today's explainer, looking at the hidden signs, the root causes, and the path forward. But I want to leave you with this final, crucial thought to reflect on. Which of these 10 warning signs might you have been overlooking? Early diagnosis and proper management can drastically improve your daily life and significantly reduce long-term health risks. So if you're recognizing several of these clues from our investigation today, please take that vital next step and consider speaking with a qualified healthcare professional.